Our bulletin. The Gauteng Health Department is facing medical negligence claims totaling over R1 billion. And get this, that's just for the past 6 months. 151 cases have been filed so far this year, and most relate to women in labor. Masego Rahlaga is following the story for us. She joins us now in studio to take us through the figures and how the department actually finds itself in this situation.
Well, Shahan, the Gauteng Health Department is second after the Eastern Cape with medical negligence cases. And this is actually not anything new, hearing that they're facing so many cases. And as you rightly said, it's mostly, children born with cerebral palsy, for instance, which is like some sort of brain damage that basically makes the human being's body not function. So basically these children have to live not being able to fend for themselves. They can't take themselves to the toilet. They can't do anything. So that's mostly what they say they've been facing. So the 151 come to them in summons since January, obviously from lawyers saying that they intend to sue for such and such a patient. And now what they do is they roped in, since the Life Esidimeni tragedy, they roped in the SIU, and the SIU is always available to check for them which claims are actually medical negligence and can go to the High Court. So that's what they're doing right now. But also, Shahan, the problem with with suing the department is that sometimes you may sue and the court finds the department wanting, and the department is told to pay a patient a certain amount of money, and the patient can probably have 10 years without being paid.
Wow,
so that's also the other issue.
That is interesting. You spoke to the HOD about this, so let's take a listen to what he had to say.
From January to now, for instance, we've received about 151 summons, which would amount to a tune of about 1.1 billion. These are just summons. But one thing we've realized that some of the litigations, there is various components. There are true litigations and there are fraudulent components. And we would like to thank the Gauteng provincial government through the Office of the Premier, where they've afforded us SIU, Special Investigation Unit, which has assisted us in, or will continue to assist us in decreasing the fraudulent claims, so that we deal with the genuine ones. And in some way also, for instance, in the previous year, 17-18, we had paid a total of about 700 million. And in the last year of 18-19, that went down to about 500 million. Because we've put things in place in terms of making sure that there is an appropriate analysis of is it a true negligent or not.
Now, this, of course, not very new for Gauteng, as you mentioned. We had the Life Esidimeni tragedy happening. What are officials doing to address these concerns?
Well, basically, Shahan, they're trying, but they're not winning. That's the simple answer that I can give you. They're talking about increasing resources, for instance. I know, remember last year when there were those deaths at the hospital in the East Rand from that Klebsiella outbreak, the minister came out, well, the former minister came out with the president saying, Gauteng doesn't have enough staff, and Gauteng is the province that actually deals with a lot of cases compared to other provinces because it also caters for the SADC region. But the resources in itself, it's not really enough. But let's listen to what the professor had to say in terms of fixing this.
The first thing as the Department of Gauteng, Department of Health, is to focus on patients' experience at our facilities. That is the major thing which can restore the public confidence. And that patient's experience speaks to the facilities themselves as you come into a facility. Is it well kept? Is it up to it? That goes a long way. And then, of course, the attitude of the staff, how they handle people coming in. And to that end, actually, part of MEC's project is to work on staff morale, in the sense that they do need some appreciation on the work they do, given, as you've already indicated, the increased workload versus the unincreasing human resource. So that is very, very important.
So this has almost become a norm for the Gauteng Health Department. Do they have a budget to deal with medical negligence?
Well, it would be awkward for a government to actually budget for medical negligence, because that would mean they're telling the country that this is what we do and so we'll budget for it. So they don't, and which basically means the fiscus is actually put under a lot of pressure because of the amount of cases that they face. And then it's just a vicious cycle, Shahan, because you are given a budget to actually improve the health system, but the health system is in tatters so much that you have to keep paying all of these claims. So what they've done is to try, for instance, and also added to that is that the law was changed in around 2011, where, like I said to you, some people would, the court would rule in their favor, a patient's favor, and that the patient doesn't get the money after 10 years, or the patient dies even before they get the money. So what the law did in 2011 is to change a certain part of the law when it comes to health and medical negligence, and say that a patient can actually attach assets now. Now the patient doesn't have to wait for actual money. They can attach assets, sell those assets, and get their money. Now what the health department has tried to do, Shahan, to basically manage this, because they can't budget for it, is they approach the Constitutional Court, and they actually won in saying that can we be allowed not to pay the patient in lump sum, rather pay the patient as and when they need, so that if they need anything that the health department can offer in the public health care, we can give it to them instead of paying them the lump sum, and then they still come back into our system anyway.
Yeah, but why would a patient who's been dealt a blow ultimately
go back, right?
Go back, yeah. Thanks so much for that. Appreciate it. Masego Rahlaga.